Hi, everybody. Thank you so much for coming to the WHO Pavilion to talk about one of my favorite things in the world, which is physician policy and advocacy work for planetary health and education. So I'm Dr. Courtney Howard. I'm an emergency physician from the subarctic in Canada. I'm a past president of the Canadian Association of Physicians for the Environment, and I'm the vice chair of the Global Climate and Health Alliance. So we are now going to go online, and again, cross our fingers this works, to hear from Charlotte Mbuh, the Geneva Learning Foundation.
Good afternoon. I am Charlotte Mbuh. I have worked for the health of children and families in Cameroon for over 15 years. I am one of more than 5,500 health workers from 68 countries who have connected to share our observations of how climate is affecting the health of those we serve. Going back home to the community where I grew up as a child, I was shocked to see that most of the rivers we used to swim and fish in have all dried up, and those that are still there have become very shallow so that you can easily walk through a river you required a boat to cross in years past. These are the words of Samuel Chukwuemeka Obasi, a health worker from Nigeria. Dr. Kumbha Gopi, a health worker from India, said, "The use of motor vehicles, cars, bicycles, and autos has led to an increase in air pollution, and we see respiratory problems and skin diseases which have an impact on health. Climate change is hurting the health of those we serve, and it is getting worse. Few here will deny that health workers are an essential voice to listen to in order to understand climate impacts on health. Yet, a man named Jacob Charit on social media snapped, "Since when are health workers the authority on air pollution?" Here are the words of Bie Lilian Bando, a health worker from my country. Where I live in Boya, the flood from Mount Cameroon took away all belongings of people in my neighborhood and killed a secondary school student who was playing football with his friends. Climate change is killing our community. Cecilia Nwabiwa, a nurse in Nairobi, Kenya, said, "I remember my grandson getting sick after eating vegetables grown along areas flooded by sewage. Since then, I resolved to growing my own vegetables to ensure healthy eating." And yet, Robert Moore found this ridiculous, as if my friend who sells fish at his fish stall comes as an expert on water quality. I wondered, why such brutal responses? Well, unlike scientists or global agencies, we cannot be dismissed as experts from on high. What we know because we are here every day. We are part of the community, and we know that climate change is a threat to the health of the communities we serve. We are already having to manage the impacts of climate change on health. We are doing the best that we can, but we need your support. The global community is investing in building a new scientific field around climate and health. Massive investments are also being made in policy. Are we making a commensurate investment in people and communities? That should mean investing in health workers. What will happen if this investment is neglected? What if big global donors say it's important, but it's not part of our strategy? Well, in 5, 10, or 15 years, we will certainly have much improved science and hopefully policy. Yet, some communities might reject better science and policy. Will the global community then wonder, why don't they understand what's good for them? I am an immunization worker. For over 15 years, I have worked for my country's Ministry of Health. Like my colleagues from all over the world, I know more than a little about what it takes to establish and maintain trust. Trust in vaccination, trust in public health. Trust that by standing together in the face of critical threats to our societies, we all stand to do better. With every challenge, there is an opportunity. On the 28th of July 2023, 4,700 health workers, began learning from each other through the Geneva Learning Foundation's platform, community, and network. Thousands more are connecting with each other because they choose to and because they want to take action. It is our duty to support them. In March 2024, we will hold the 10th Teach to Reach conference. The last edition reached over 17,000 health workers from more than 80 countries. This time, our focus will be on climate and health. We invite global partners to join, to listen, and to learn. We invite you to consider how you, your organization, your government might support action by health workers on the front line. Because we will rise. As health workers, with or without your support, we will continue to stand up with courage, compassion, and commitment, working to lift up our communities. Our perseverance calls us to press forward towards climate justice and health equity. I wish to challenge us as a global community to rise together so that the voices of those on the front line of climate change will be at the next conference of parties. By standing together, we all stand to do better. Thank you.
Charlotte, or Joe, what's your best move so far? What's the best move that you think you've made in terms of getting this into curricula? Like when you look back and you think, okay, that actually worked.
So for us, we know that formal curriculum in pre-service training is important. But so that is why for us at the Geneva Learning Foundation, we are really focusing on peer learning between health workers who are already being confronted by brutal consequences of climate on health. And I'm also talking here from personal experience. And so there is, we cannot afford to wait right now. So our real concern, our main concern is really that global donors and governments are not investing enough on health workers who are considered trusted advisors to their communities now. And the more we wait, the more the problems are compounded. And so the consequences could be dire later. So even as pre-service education formalizes teaching health staff about climate and health, I think it's also important. And I listened to what the pastor said, that is engaging nurses, engaging the medical associations. But really, what we do is trying to engage with health workers across system levels. That is those who are closest to the communities on the front lines at the health facilities, as well as those that are at the district level, subnational levels, or those who are policymakers or at the strategic national Ministry of Health levels, and also cutting across organizational affiliations. That's in terms of we have civil society organizations that are involved, people working for a non-governmental organization, as well as those working for ministries of health in their country. So we believe that a platform where everyone can interact and share experiences, learn from one another what they are doing to address the challenges that they face as far as climate change, the impact of climate change on health is concerned, is really important. Yeah.
That makes sense. Yeah, really, really incredible work. So we're going to open the floor now to questions from people. I know there's people in the audience who are involved in this work. Have we got a roving mic? I think that we have one that's, or we'll grab this one. Okay, sure.
Evgenia Voivod at the University of Arizona. Thank you so much for brilliant presentations and all the provided insights and inspirational personal success stories. I would like to ask you, what do you think, what potential teaching or educating techniques or approaches would be efficient to educate health professionals, including public health professionals? What we can introduce?
Yeah, from my experience, peer learning is the lowest cost, highest return type of education. And such peer education can actually be led by the health workers themselves. And it will be for health workers who are part of the communities. So, but peer learning it seems to be less familiar in health education than expert-led training. So for climate effects on health at the community level, so little is known. And I think we need to be humble to start by learning from each other. And I think what we did was really hear from these health workers across several countries, just sharing what they had observed and the little they were trying to do. And we need to recognize that the community is really the expert. They know their context, they know what is happening, and they know what can be done to mitigate the effects. So we need to learn with them, from them, and also for them. And it's also important maybe to get the medical students, the midwives, the nurses out of their school buildings and the hospital rooms into the communities, so that side by side with families, we can learn together and try to face this global health crisis together. So yeah, I think that's my view in addition to all that which has been said.
That makes sense. Yeah, there was a really good peer learning program that we had in Canada for a while. It was a train the trainer program on air pollution, and that worked great. And then the funding got canceled. And I think, Joe, I've been thinking that's one of the things that we could go pester Health Canada to start up again, because it actually worked, you know. Okay, is there another question? As was pointed out, not enough research, particularly from the Global South. Charlotte, do you have a comment about mechanisms or priorities for research in this area in the Global South?
Maybe before I talk a little bit about that, I wanted to just to say that there seems to be, and it's important, the focus on education. But what we try to do is taking a step further by laying emphasis on concrete action. And that's why what we try to do with the health workers that we engage with across our network. There is we get lots of stories of what health workers are doing in their context to address the challenges that they are facing as a result of the climate change on health. And there is a story that is a particular quote from a health professional in Ghana that I found quite interesting, and I would like to read to you. He said, "There is no health without a healthy environment. Let us teach our communities simple things to help make our environment healthy." That is simple. It's really maybe the medical students, if you know what needs to be done, is it tree planting? And we got some interesting stories from health workers saying that as part of their awareness raising activities in communities, they join community members to plant trees, to learn how to clean up, on how to manage waste and all of that. So those are little things that can actually make a little bit of difference. Now, in terms of research, that is one thing we are also one of our missions as well. And it will be important if the global north, and really considering that most of our network is made of health professionals from the global south, there is a rich network where surveys, for instance, before we organized the event on the 28th of July, we sent out a survey, and we got in less than 2 weeks over 1,200 people coming back to tell us that climate change was a concern for them, that their communities were worried, and they were observing things that were not going the way they were supposed to go, and that a few of them were already taking action. So I think research to really knowing exactly what is happening at the community levels in the global south as far as climate change is concerned is very important, and really something that should be looked into.
Wonderful. Thank you. Well, we're out of time, and I just want to say thank you to everybody who has planted seeds of knowledge in me today. Your stories of the long course to get here and your wins, your thoughts as a new doc, Joe, and your really concise trip through what's actually worked in Canada. And Charlotte, these seeds of knowledge you've planted in us, I think I'm going to really take away this peer-to-peer learning. I think that's an amazing, I think where I live, underutilized technique. Okay, thanks everybody. Let's go forth and plant many seeds. Start a revolution. All right, take care.